Okay, for our final topic sa maternal natin, we will be talking about lesson 6, 7, and 8. Okay, yung mga health problems common in preschool and also sa mga school age group and sa mga adolescents. First one is the health problems common in preschooler. Okay, when we talk about the preschooler, this is 3 to 5 years old. Okay, first one is leukemia. Okay, leukemia, it is a proliferation of abnormal white blood cells. Okay, when we talk about white blood cells, diba ito yung mga leukocytosis. Okay, proliferation, this is to increase greatly in number or amount. Okay, wherein ang normal na value natin for white blood cell is 4,500 to 11,000 per microliter. Okay, and then, di ba sabi natin, kapag leukemia, it is called the cancer of the blood. Okay, it is several different types of leukemia exist, and classification has become a complex process. And the most common leukemia in children is acute lymphocytic leukemia, or what we call the ALL, which is proliferation of the blast cells or the immature lymphocytes. ALL is classified by form, structure, and the morphology of the blast cells. Okay? And then dito sa ALL natin, this is the disease processes rapidly, okay, and creates immature blood cells rather than the mature ones. Leukemia may be diagnosed at any age but has a peak onset between 3 to 5 years of age. Okay? For the etiology, it is unknown, and a fewer cases in adults have been linked to environmental factors such as chemical and also yung mga radiation. Several genetic diseases have been associated with increased incidences of leukemia, including those with Down syndrome. Di ba sa Down syndrome, it is the presence of constitutive trisomy of chromosome 21 in Down syndrome act as a genetic driver for leukemia development. Fanconi anemia naman, this is a rare genetic disorder in the category of inherited bone marrow failure syndromes. And also, ang include din dito is the Bloom syndrome. For the Bloom syndrome, have an increased risk for cancer. It is a inherited disorder characterized by short stature, a skin rash that develops often after the exposure to the sun. So that is the etiology of leukemia. Okay, for the pathophysiology, malignant leukemia cells arise from precursor cells in blood, forming elements. Pag sinabi natin precursor, are stem cells that have developed to the stage where they are committed to forming a particular type of new blood cell. And also, these cells can be accumulate and crowd our normal bone marrow elements and spill peripheral blood and eventually invade all the body organs and tissues. And there is also a replacement of normal hematopoietic elements by the leukemic cells, results in bone marrow suppression, which is made by a decreased production of the red blood cells, normal WBC, and also the platelet. And the bone marrow suppression results in anemia from decreased red blood cell production. Predisposition to the infection due to neutropenia. When we talk about neutropenia, this is a low level of neutrophils, type of a white blood cell, and bleeding tendencies due to thrombocytopenia, which is a low level of platelet count. This put the child at risk of death from infection and also hemorrhage. Infiltration of reticuloendothelial organs, okay, like the spleen, liver, and lymph glands, causes marked enlargement and eventually fibrosis. For the reticuloendothelial organs, it plays an important role in host defense by the removal of the foreign material. And pag sinabi natin fibrosis, this is the thickening or the scarring of tissue. And next one is leukemic infiltration of the central nervous system results in increased intracranial pressure and other effects depending on the specific areas involved. Other possibilities also sites of long-term infiltration include the kidneys, testes, prostates, ovaries, GI tract, and the lungs. Okay, and taas ko lang siya. Okay, the hypermetabolic leukemic cells eventually deprive all the body cells of nutrients necessary for survival. For the hypermetabolic, this is excessive increase in metabolic activity. The uncontrolled growth of leukemic cells, this can eventually result in metabolic starvation. For these leukemic cells, it can impact a person's ability to consume enough nutritious foods, reduce the physical activity, affect muscle function, and also hinder the body's ability to absorb nutrients from food. So that is the pathophysiology of leukemia. Okay, for the assessment and findings, for the clinical manifestations, anemia, which is a fatigue, pallor, and tachycardia. Yan yung mga makikitang manifestations. Okay? Bleeding, which include petechiae. Sa petechiae, this is a pinpoint red or the purple spot. And purpura. Sa purpura natin, rash of purple spot, bigger or larger than the petechiae. And epistaxis, ito yung nose bleeding, and tarry stool, ito yung black na color ng stool. And also immunosuppression. There's a immunosuppression which manifests a fever, infection, or poor wound healing. Hepatosplenomegaly, okay, bone pain, and also the lymphadenopathy. Sa lymphadenopathy natin, this is a swollen glands or swelling of the lymph nodes. Itong gland natin na lymph nodes is body is kapag nagsaswell kasi itong lymph nodes natin, the body is fighting an infection. Okay? So next is the CNS symptoms. If there is CNS metastasis, okay, headache, meningeal irritation, and signs of increased intracranial pressure. Diba? Pag increased intracranial pressure, there is a presence of headache, vomiting, and also altered mental status. And for the general symptoms, we have the weight loss, anorexia, and also vomiting. And for the laboratory and diagnostic study findings, the CBC may reveal normal, decrease, or increase WBC count with the mature cells or the blast, decrease RBCs, and decrease in platelet. Sa bone marrow aspiration, this is a confirmatory diagnosis by revealing extensive replacement of the normal bone marrow elements by the leukemic cells. Okay, another one is the lumbar puncture. Okay, this assesses the abnormal cell migration to the CNS. They take a cerebrospinal fluid samples para magawa itong lumbar puncture natin assessment. Okay? For the nursing diagnosis, we have risk for injury because of the easy fatigability ng patients, risk for infection because they are immunosuppressed, risk for trauma, and risk for fluid volume deficit due to the bleeding, altered nutrition less than the body requirements, okay, because the inability to absorb iron or vitamins or the poor diet. Okay, altered oral mucous membranes, altered oral mucous membrane natin due to dehydration, sa vomiting, and also sa malnutrition. Okay, and also pain, risk for altered growth, pag di na sapat yung mga nare-receive nila na mga nutrients, risk for altered development, altered family processes, and also anticipatory grieving. So that is the nursing diagnosis for leukemia. Another one is the planning and outcome. The child will experience complete or partial remission from the disease. The child will not experience an oncologic emergencies. The child will not experience no to minimal infection. And also, the child will demonstrate no evidence of bleeding. So, ito yung mga goals natin. The child will remain adequately hydrated and experience minimal nausea and vomiting. The child will receive adequate nutrition. Okay, the child's oral mucous membrane will remain intact. The child will be pain-free, and also the child will maintain appropriate growth and development. The child and family will receive adequate support, and the child and family will cope with the possibility of death. Okay, so that is the planning and outcome natin. And also for the nursing management, okay, assist in ensuring partial or complete remission from the disease by administering the chemotherapy and by preventing or minimizing and also the complications of the chemotherapy, radiation, and bone marrow transplant. Okay, for this one, sa ating chemotherapy kasi, they use as a medication that are designed to kill or shrink the growing cancer cells. While the radiation therapy, it kills cancer cells by using beams of high energy, example sa mga X-ray or the protons. And also for the BMT or the bone marrow transplant, they replace damaged bone marrow to a healthy one, which itong bone marrow na to, it contains cells that produce blood cells and also platelet that are responsible for making billions of new cells each day. So, ito yung mga gagawin nilang treatment. And also, follow guidelines and institutional policies for administration. Observe for signs of infiltration and also irritation at the infusion site. Observe the child for 20 minutes to note for any signs of anaphylaxis. For this anaphylaxis, yung mga signs and symptoms is difficulty of breathing, tachycardia, clammy skin, confusion, and then losing consciousness. Okay? And then, ang side effect kasi ng mga chemotherapy natin is hair loss, tingling, burning weakness, numb, tired, achy muscles, and loss of balance. Okay? So, keep emergency equipments and medications nearby always. Monitor for specific chemotherapeutic side effect, yung sabi nga natin kanina, as well as the general side effect. Okay, monitor also for side effects of radiation therapy, which is hair loss, appetite changes, trouble swallowing, swelling, coughing, diarrhea, nausea and vomiting, and also urinary and bladder changes. So we should take note of these side effects ng mga treatment for chemotherapy and also for radiation therapy. Okay? Uh, Monitor for complications of the bone marrow transplant. Taas lang natin. Okay? For the BMT, when successful, destroys the leukemic cells and replenishes the bone marrow with healthy cells. Okay, pero there is a complication for the GIT. There is a nausea, vomiting, anorexia, diarrhea, mucositis. This is the inflammation of the mucosa. Yun yung mga it lined the mouth and also the entire GIT. Okay, another one is infections. Another complication is anemia and bleeding. Renal complications also, like hypovolemia, hypoproteinemia, dehydration, and septic shock. Itong septic shock, i-watch out natin kasi the BP drops to a dangerously low level after an infection. Okay, another one is interstitial pneumonia. There is a fever, nasal flaring, tachypnea, dyspnea, dry cough, and also hypoxia. This is characterized also by an inflammation process within the interstitial walls rather than the alveolar spaces, itong interstitial pneumonia. Okay? Another complication is the graft rejection or failure. So, kapag ka na-reject ng body niya, there is a fever, okay, infection, and also decrease in blood count. So, there is also complications sa mga treatment na kailangan ding i-watch out. Okay, another one sa nursing management natin is monitor for and minimize pediatric oncology emergencies, prevent infection, and also prevent trauma from bleeding and immobility, ensure adequate hydration, prevent mucositis, and also prevent pain, foster healthy growth and development, assist also the family in coping with their child's disorder, and assist the child and family with the grieving process kapag hindi na kaya. Okay? So that is all about the leukemia. So next one, we proceed with the Wilms tumor or the nephroblastoma. Okay? For this one, Wilms tumor is a malignant neoplasm of the kidney. It is the most common intra-abdominal tumor in children and the most curable solid tumor in children. Occurs most often in young children but may occur in adolescents. The median age at diagnosis is between 2 to 3 years old. Okay, usually it is unilateral and occurs with other abnormalities such as absent iris or what we call the ani aniridia. Okay? Aniridia or genitourinary problems ang mga abnormalities. Okay, for the etiology, etiology is unknown and also siblings of children with Wilms tumor have a higher risk of developing disorder than the general population. Okay, so for the pathophysiology, the tumor originates from immature rhinoblast cells located in the renal parenchyma. Okay, sa renal parenchyma, this is the functional part of the kidney that includes the renal cortex, which is the outermost part of the kidney, and also the renal medulla. Okay, it is well encapsulated in early stages but may later extend into lymph nodes, and the renal vein and vena cava are metastasized to the lungs and other sites. Okay, so there is a 5 stages. Stage 1, the tumor is confined in one kidney. Kapag stage 2 naman, the tumor extend beyond kidney but can be resected. Pag resected, this can be surgically removed. Okay, pwede pa siya matanggal. Okay, for the stage 3, the tumor has residual non-hematogenous tumor cells confined to the abdomen. Pag sinabi nating non-hematogenous tumor, this is non-originating in the blood. Okay? So, sa stage 4 natin, the tumor is characterized by distant metastases involving the lungs. Ibig sabihin, kumalat na siya sa lungs, sa liver, sa bone, or sa brain. Okay, nagmetastasize na. Okay, stage 5 naman, the tumor involves both of the kidney. So, that is the stages of the Wilms tumor. Okay, for the assessment finding, clinical manifestation, which is the abdominal mass. This is a common sign, usually discovered during a routine assessment or by parents when batting the child. So, napapalpate siya. Okay, nakikita by inspection. Okay, other characteristics may include fever, abdominal pain, hematuria, hypertension, and anorexia. Okay, for the laboratory and diagnostic study findings, they are using the ultrasound or the CT scan reveals that there is a mass. Okay, other studies may be performed if metastasis is suspected. Okay, para malaman kung saan na siya kumalat. Okay, for the nursing assessment, okay, assess a child for hypertension. Do not palpate the abdomen. Doing so can rupture the encapsulated tumor and cause dissemination of the disease to the adjacent and distant sites. Okay, so wag natin i-palpate yun nga. Baka kumalat pa siya lalo sa mga other organs na malapit sa kanya. Okay, administer medications like the chemotherapeutic agents. Okay, provide post-operative care after the operation, monitor yung mga bowel sounds, and assess for signs and symptoms of intestinal obstruction resulting from the abdominal surgery. And also, we should always prevent infection. Lalong-lalo, they are risk because they are kaka-opera pa lang nila. Okay, prevent also post-operative pulmonary complications. Okay, so that's all for the Wilms tumor. Next one is the asthma. Okay, for the asthma, asthma is a chronic reversible obstructive airway disease characterized by wheezing. Yun yung parang high-pitched sound na naririnig natin. It is caused by spasm or ito yung nagtatighten, sumisikip, yung mga bronchial tubes or there is a swelling sa bronchial mucosa after exposure to the various stimuli. Depende kung ano yung nag-trigger dun sa asthma attack niya. Okay, it is the most common chronic disease in childhood. Most children experience their first symptoms by 5 years of age. For the etiology of asthma, commonly results from hyperresponsiveness of the trachea and bronchi to irritants. Okay, allergy influences both the persistence and the severity of asthma. And the atopy or the genetic predisposition for the development of an IgE-mediated response to common airborne allergens is the strongest predisposing factors for the development of asthma. So we have the common irritants, we have the allergen exposure sa dust mites, okay, molds, and animal danders. Okay? So, kung may allergy ka kapag nagwawalis ka, kaya bawal ka magwalis kasi natitrigger yung asthma. Okay? For example, allergy ka din sa mga balahibo ng mga pusa. Okay? Next one is the viral infection. Pwedeng it can trigger, maging irritant siya. Irritants would includes air pollution, okay, smoke, perfume, laundry detergent. So there's madami tayong mga irritants for asthma attack. Okay, certain foods also, mga food additives. Rapid changes in environmental temperature, may iba kasi na ayaw nila ng sobrang lamig, may iba naman na ayaw nila na mainit yung lugar, doon na umaatake yung asthma. Okay, and also exercise, lalong-lalo kapag vigorous yung exercise, mapapagod sila. And also yung mga psychological stress, it can lead to the na matrigger yung asthma attack. Okay? For the pathophysiology, an asthma attack may occur spontaneously or in response to a trigger. Either way, the attack progresses in the following manner. There is an initial release of inflammatory mediators from the bronchial mast cells and epithelial cells and macrophages, followed by activation of other inflammatory cells. Okay, alterations of autonomic neural control of the airway tone and epithelial integrity occur, and the increased responsiveness in airway smooth muscle results in the clinical manifestation like wheezing and dyspnea. Okay? Three events contributes to the clinical manifestations. There is a bronchial spasm or there is a tightening of the airway, inflammation and edema of the mucosa, and also there is a production of thick mucus which results in increased airway resistance, mas lalong sisikip yung dadaanan ng hangin, premature closure of the airway, hyperinflation, increased work of breathing and impaired gas exchange. So there is magiging problem yung impaired gas exchange because of the tightening of the airway and also the inflammation and then yung increased natic production ng mucus, okay? And another one, if not treated promptly, status asthmaticus, it is a respiratory failure that comes with the worst form of acute severe asthma attack. Okay, this is an acute severe prolonged asthma attack that is unresponsive to the usual treatment, may occur and requiring hospitalization. Okay, for example, meron siyang gamot na either nebulization or inhaler. Hindi na kaya nung gamot niya kasi kapag status asthmaticus, nag-close na yung airway. So, immediately, hospitalization na agad ang magiging treatment ng patient para matulungan siyang huminga. Okay? For the assessment findings, okay, clinical manifestations, makikita natin there is an increase in respiratory rate, and then yung wheezing sound, yung high pitch, and also productive cough because of the production of thick mucus. Okay? And then the use of accessory muscles in breathing para ma-aid yung paghinga niya, matulungan niya yung sarili niya. Distant breath sounds. Kapag sinabi kasi distant breath sound, parang ang layo nung pinapakinggan mong sound because of the increased thickness of chest wall. Either there is an air or fluid in around the lungs. Okay? Fatigue. Pagod sila yan. Moist skin and also anxiety and apprehension. There is an apprehension is anxiety or fear that something bad will happen. Okay? Kasi hindi nila alam kung makakaya nila yung attack or hindi. Okay? And also dyspnea, difficulty of breathing. Okay, laboratory and diagnostic study findings. Spirometry will detect that there is a decreased force in expiratory volume or the FEV. It means that there is an obstructive pattern kapag once na-decrease ang FEV. Okay, decrease PEFR or the peak expiratory flow rate. Okay, there is an start of an asthma episode kapag decrease yan. Diminished forced vital capacity or the FVC. It indicates also an obstructive pattern. Kapag diminished inspiratory capacity naman, the lungs are not able to expand sufficiently to breathe as deep. Okay, hindi sila masyadong nakakapag yung inhale, sobrang lalim kasi nga hirap mag-ano yung baga nila because of the tightening or the stiffness nung airway nila. Okay? For the nursing management of the asthma, okay, syempre assess natin yung respiratory status ng patient. Okay, prescribe medications, yung mga bronchodilators natin para lumawak yung paghinga nila. provide or promote adequate oxygenation and a normal breathing pattern. Sabihan natin sila, either sa oxygenation kapag ka nasa hospital na sila, okay, they are given oxygen supplementation. And also sa normal breathing pattern, teach natin sila for deep breathing exercises habang nagre-receive din sila ng mga oxygen supplement. Explain the possible use also of hyposensitization therapy. This is an allergy desensitization wherein this is a form of immunotherapy where the patient is gradually vaccinated against the progressively larger dose of the allergen in question para ma-desensitize. Okay? Help also the child to cope with the poor self-esteem and discuss the need for periodic PFTs. The pulmonary function test, this is a non-invasive test that show how well the lungs are working and also provide the child and the family teaching. Refer the family to appropriate common community agency for assistance. So that's all about our asthma. Okay, next one, proceed with the urinary tract infection or the UTI. UTI are characterized by inflammation usually of bacteria origin of the urethra or the what we call the urethritis. Sa bladder naman, kapag there is inflammation, what we call the cystitis. Kapag ureters naman, urethritis or sa kidney, pyelonephritis if there is an inflammation sa mga part na yan. Okay? Peak incidence occurs between 2 and 6 years of age with increased incidence also noted in adolescents who are sexually active. Girls have a 10 to 30 times greater risk of developing UTI than boys, except sa mga neonates, because of their shorter urethral structure which provides a quick pathway for organisms to para maka-enter sa mga part ng uh, urinary system. Okay, the recurrence rate in neonate is 25%. Sa children naman, older children is 30%. Okay, for the etiology, okay, the gram-negative bacteria or the E. coli or the Escherichia E. coli accounts for 80% of all the UTI. The remaining 20% are caused by other gram-negative bacteria such as the Proteus, Pseudomonas, Klebsiella, Haemophilus, and coagulase-negative Staphylococcus, and the gram-positive bacteria, and also the Staphylococcus aureus. Okay, in the neonate, the urinary tract may be infected via the bloodstream. Okay, in older children naman, bacteria ascend or paangat, pataas, the urethra, okay, creating an increased incidence in girls. We have the contributing factors include urinary stasis, wherein ini-stop yung pag-ihi, okay? Stopping the urine. Urinary reflux, urine flows backward from the bladder to ureter and sometimes the kidney, usually because of a birth defect of urinary tract. Di ba, for ang urine dapat is pababa, dapat siya from the kidney down to the urethra. Ang nangyayari is bumabalik siya paangat, pataas, pabalik, which is the reflux, okay? Inadequate fluid intake, and also poor perineal hygiene, di ba? Pag hindi hygienic or hindi maganda ang hygiene practices, there is a really great chance for having a UTI. Okay? Constipation because the bacteria that normally live in the large intestine and present in the feces. Okay? Pregnancy and also non-circumcision, indwelling catheter placement, lalong-lalo kapag hindi nalilinisan mabuti, antimicrobial agents that alter the normal urinary tract flora, tight clothes or diaper, so it can also cause, local inflammation and also yung nagagamit ng bubble bath. Okay? Bubble bath, ito yung nag-i-stay long ka kasi dyan and then magiging irritant kasi siya. Okay? For the pathophysiology naman, in the uncomplicated UTI, inflammation usually is confined to the lower urinary tract. Recurrent cystitis, ito yung inflammation of urinary bladder. However, may produce anatomic changes in the ureter that lead to vesico-urethral valve incompetence and also resultant urine reflux. This provides organisms with access to the upper urinary tract. So, umakyat. So, there is a chance na pwede silang pa-ascending yung infection. Okay? Pyelonephritis, ito yung kidney infection, usually results from an ascending infection from the lower urinary tract. It can lead to acute and chronic inflammatory changes in the pelvis and medulla, which with scarring and loss of renal tissue. And also, when there is a recurrent or chronic infections, results in increased fibrotic tissue and kidney contraction. Sa fibrotic natin, there is an overgrowth or hardening and scarring. So, for the assessment findings, characteristic may vary with age and location of the infection. About 40% of the UTI are asymptomatic. So, we have a clinical manifestations. Infants may exhibit irritability, constant squirming, which is due to the pain or discomfort, fever or hypothermia, jaundice, weight loss, FTT. Okay, for the FTT, failure to thrive. Okay, failure to thrive, fail to grow and develop normally, and also vomiting and diarrhea, okay, diaper rash, and an abnormal urinary stream. Okay? Older children also may exhibit manifestations according to where the infection is located. There is a foul-smelling urine, hematuria, there's a possibility, dysuria, increased frequency, increased urgency, incontinence, and also abdominal pain are seen with the lower urinary tract infections. Okay, there is also a fever, costovertebral abdominal tenderness, chills, and flank pain are seen with the pyelonephritis. Pyelonephritis yun yung ating kidney infection. So that is the manifestations for the laboratory and diagnostic study findings. Okay, sa urinalysis, okay, gagawin talaga ang urinalysis. There is a hematuria, okay, blood in the urine, proteinuria, there is a protein in the urine, pyuria, there is a pus. Urine may have a foul odor and appear cloudy with strands of mucus. So, nakikita na dyan sa urinalysis. Urine culture is used to confirm diagnosis, so confirmatory. Okay? Through the detection of bacteria. Kasi urine culture kasi, kinukulture nila kung ano talaga yung pinaka-bacteria na nag-cause, a specific name of the bacteria na nag-cause ng UTI ng patient. Okay, urethral catheterization ang gagawin dyan. And then, bladder wash out procedures and radioisotope renography may be needed to localize the infection. And also, renal ultrasound, titignan, by the use of the imaging device. So, that's yung mga gagawin sa mga laboratory and diagnostic studies. Okay? And for the nursing management, okay, nursing management ng UTI, assess urinary status. Okay, nahirapan ba siyang umihi or hindi? Tama ba yung output ng patient natin? Ano yung quality? Ano yung nakikita doon sa urine? Kung ano yung color, yan, consistency, kung yung amoy ba niya, di ba? Ganun yung mga assess natin. Administer prescribe antibiotic. Okay, pag nalaman na yung specific na bacteria na nagkukos, yun na yung lalabanan nila with a specific antibiotic. Can also prevent infection, provide comfort measures, okay, and also provide child and family teaching. So, ituturuan natin sila para ma-prevent kung sakaling magamot na sila para hindi na siya mag-reoccur. So, that's all for the urinary tract infection. Yan yung mga common problems sa mga preschool natin.